If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, how long can you go with having diabetes before knowing you have it? Answer by Kristen Larson Stefaniak. To reiterate and emphasize what others have answered, type I diabetes, not very long before the symptoms would land you in hospital where it would be diagnosed, hopefully but not necessarily before extensive permanent damage to the body or even death occurred. Type 2 diabetes, any number of months up to many years, depending on things like body weight, diet, exercise, remaining ability to produce insulin, degree of insulin resistance, and etc. Diabetic symptoms can therefore range from deceptively mild to debilitating. Symptoms of diabetes can include excessive and/or frequent thirst, frequent urination, episodes of visual distortion, especially blurry vision, unexplained fatigue, a sweet or fruity odor to the breath and/or the urine, thrush, particularly but not exclusively in women, dental problems including gum disease, numbness, tingling or pain in the extremities, especially the feet, and a number of less common ailments. Diabetes is a very serious but also very treatable disease. If you have the slightest concern that you or a loved one may have either type of diabetes, please have your blood level of HbA1c checked immediately. This test is widely available practically everywhere in the world and can be obtained from any physician. In some countries, you can even purchase a home testing NG kit directly from your pharmacist to be interpreted by a medical professional. If for some reason you are unable to do that, at least have your blood sugar level checked after fasting for 812 hours, even if you have to borrow a diabetic friend's home test kit to do so, and report the results to your physician. When untreated, diabetes causes significant problems with blood circulation, which can lead to heart, kidney, and liver failure, blindness, nerve damage, amputation and death. Fortunately, 10 years ago I was diagnosed with type 2 diabetes after a lifetime of suffering from some other endocrine issues. With medical treatment and a few relatively minor lifestyle changes, I remain robustly healthy. Answer by Daphne I can answer for type 1. My own experience was quite dramatic. I'd gotten a routine full body checkup, including blood sugar, and had a clean bill of health. 4 months after that, I started to feel a strange bloated feeling in my stomach that felt like indigestion, antacids provided no relief. 2 days later, I suddenly got extreme nauseas and could not keep even water down, and had dry mouth. 2 days later, I was so weak I could not move even to turn over in bed. My family took me to the ER where my blood glucose was an eye-popping 78 mmol/L or 1,404 mg/dl. After barely surviving the night, I was in intensive care for a few days. It turns out that I had abruptly developed type 1 diabetes, which led to diabetic ketoacidosis, DKA, which progressed rapidly over just 4 days, as far as we know, because I had been perfectly fine with no symptoms at all before that. Mine was an extreme case. Other type 1s whom I spoke to estimate they had it for anywhere between a week to a couple of months before finding out. Due to the nature of type 1, your body produces no insulin at all. It doesn't take long for symptoms to appear and get dangerous. My current knowledge of type 2 is from speaking with people who have it, and most seem to just not realize they have it until they have a reason to get a blood test or routine checkup. Those who went to get checked after feeling symptoms like tingling remedies would have had it many years by then. However, I know one person who thinks she very likely has it because she has felt a few symptoms. She did not specify which ones, for about a year, but is avoiding getting tested because she'd rather not know. If you have any reason at all to suspect you might have diabetes, go see your doctor. It takes all of 5 seconds to get a finger prick test, and it'd say 5 seconds and a consultation fee are worth setting your heart at ease or confirming a suspicion and starting treatment as soon as possible. Edit. I just remembered, someone close to me had acanthosis nigricans, darkening of the skin around the neck, armpits, groin, sometimes elbows, since she was a child, close to adolescence, and at the time her doctor did not know it was a pre-diabetic symptom. She was later diagnosed with type 2 diabetes at the age of 29. My conclusion is that she had prediabetes or even diabetes for many years, possibly up to 20 years, before being diagnosed, and only because she had her blood tested for something unrelated. Answer by Eric Johnson. A major problem in answering this question is that case subjects don't know how long they've had diabetes in the first place, so it is pretty much impossible to give a full-fledged scientific response. I can, however, give a personal anecdote. Keep in mind that much of this is in hindsight. I'm told, though, that hindsight is 20/20. I first began noticing symptoms of diabetes when I was 7 years old. I would often vomit in the morning, especially during the summer months, and I'm pretty sure I wasn't pregnant. As I got older, the symptoms worsened. I began experiencing the shakes and even passed out a few times. When I hit puberty, some major anxiety set in centered around a fear of suddenly collapsing. Doctors couldn't seem to catch the causes via blood tests, and attributed the whole scenario to hay fever combined with high anxiety. Since Eva learned that when my blood sugar dips, my sinuses begin producing an incredible amount of mucus for some inexplicable reason. This created a gag reflex as I experienced overnight lows and caused the vomiting. Every diabetic has their own unique symptoms, I suppose. Today I always have a snack before bed. Problem solved. When I was 15, that the symptoms began to really intensify. I grew to 6 and weighed 120 pounds. I got tingling in my hands and arms and couldn't for the life of me stay awake if I sat still. High school was difficult. I developed an incredible fear of hot and humid weather, though I was a lifeguard and a farmhand, go figure, to the point I learned to suppress panic attacks. Doctors still claimed allergies were the reason, and I needed to get over my fears. So the worse my diabetic symptoms became, the harder I would push myself to overcome. I joined the army when I was 17 and the problem significantly worsened. Even the DOD-MERV physical missed the diagnosis. I was constantly thirsty and constantly urinating. I couldn't eat enough to stop the low, or maybe high, blood sugar tremors. My cheeks were flushed and hot and I was having trouble breathing and passed out often. Doctors still couldn't diagnose via blood work and chalked it up to anxiety and allergies. The reason why I think doctors missed it for so long was I was constantly running or weightlifting, so my fasting blood glucose was always normal. Even as a kid, I was riding my bike at least 5 miles a day. Finally, as I was training for ranger school, I went to my own PCP and was given a simple blood sugar finger poke test in office. Bingson. 424. While the disappointment of being released from the military set in later, the relief during those first few weeks was indescribable. To have answers after a lifetime of confusion was like being released from prison. I guess the moral of my story is every diabetic is different. Even my own symptoms changed from year to year. If symptoms were more uniform, perhaps I would have been diagnosed at a much earlier age. I always knew something was wrong, but was very key to accept doctors' opinions at face value. Listen to your body, people. If you think it is trying to tell you something, it probably is. I went at least 14 years misdiagnosed, and I often wonder how that time will affect my health in my later years.